And welcome everybody to this evening's Sustainable Pharmacy Network event. My name is Nuala Hampson. I'm the pharmacy lead here at CSH, and I'll be facilitating this evening's event. So we have two inspiring speakers this evening to talk to us about disposal of medicines and reuse of medicines. So first up we have Tracy Lyons, and Tracy Lyons is the Principal Pharmacist in Medicines Optimisation and Sustainability at NHS Dorset. And following Tracy will have Dr. Madeleine Smith, who's a GP and Clinical Director at South Somerset West. So over to you, Tracy. Thank you.
Oh, brilliant. Thank you so much, Nuala. And lovely to see everyone this evening. We'll just kick off straight away. So I'm here actually on behalf of a collaborative group of people who undertook a piece of work a year or so ago looking at how patients dispose of unwanted medication. And it was important for all of us. We'll have an environmental lean in the way that we carry out our work. And over the years, I think we've just accumulated evidence and knowledge that means that we're really concerned about what patients do with their medication to make sure they use it properly. I think the fact that really struck me and struck a lot of us in the working group was that, there's a knowledge that every waterway in England now is contaminated with pharmaceuticals, and we thought, this is not a minor point. We have to recognise that this impacts the world around us. We know it changes the behaviour, the reproduction, the physiology of the environment in which of the animals in the environment in which we live. And although we can't extrapolate out to human health for most medications, we know that where antibiotics are found in the environment, that's a direct risk to human health because of the establishment of antimicrobial resistance. But when you look at the literature, it's not just antibiotics. We have to realise that there are many classes of drugs that are found in the environment when we undertake testing, including antimicrobials, but also analgesics, antidepressants, antidiabetics, all sorts of things. And they get into the waterway and into the local environment through a number of different routes. And this diagram tries to summarise those. And for some of these processes, they are out of our control. So we're not going to have an impact on the farming industry or the treatment pathways used at water management plants, but we can have an impact on how patients dispose of their medication because we interact with them so often, and because we can facilitate communication information with our patients. So we thought this is something we really want to get involved in because this is something we can improve for us, for our patients and our community. And the inspiration for this work came from a report in 2022 by the Organisation for Economic Cooperation and Development, which is a global organisation that works with about 100 countries all over the world. And they looked at disposal patterns and behaviours of patients in numerous different countries globally. And they found that up to 50% of medication was disposed of incorrectly on average, regardless of the country you looked at, and in some places it was much higher. Really interestingly, they found out that there were some themes that fell out of this research, that patients dispose of their medicines differently because of the formulation it was presented to them in, and also because of the location that they derived it from, where they'd sourced the medication from. So we thought this was really interesting. We wanted to see if this translated out beyond this piece of research that was, a few years old. And also, while we were looking at that, we thought, we're always trying to make sure that we can maximise the value of the impact within the NHS of medications used, and all of this waste medication has zero therapeutic impact. It's medicine that we are literally losing. We can't give it to a patient to make them better. It's incredibly wasteful. I think we looked at the primary care medicine spend over the last 12 months, and it was about £11 billion across England and Wales. So if we think about 10% of that is estimated to be unneeded. This is a huge amount of medication that is just falling into a void, that's not helping patients and is actually could be hurting them. So, and we thought, right, this is something we really want to get involved And this was the outcome of the study that was presented in the OECD report. They found that about 20% of patients were taking their medicines to where it should go, which is primarily back to a community pharmacy for high temperature incineration, which is brilliant. But about 60% of patients were putting the medication in the bin, which is just heartbreaking. And about 10% was being flushed down the toilet, particularly liquid medicines, which again sort of piqued our interest. We thought, is this a theme that we're going to see again and again? So as a result of that, I worked with one of my trainee pharmacists in Dorset, and she undertook a pilot of about 50 patients in one hospital in Dorset the following year. And we found that even in that small number of patients, we found that similar trends in change in behaviour according to formulation and according to where the patients had received the medication from. So we thought this was enough to sort of inspire us to take this further. And so I reached out to colleagues around the country. And this is where I just want to say a big thank you to the representatives of the teams here. Because although I'm presenting the information, I didn't collect it. It was collected by a team of healthcare professionals at these organisations, at these NHS trusts, and they collected it during business as usual while looking after their patients and running their departments. So I am eternally grateful to these teams. And we surveyed 765 patients. We surveyed adults and the parents or carers of paediatric children where there were paediatric hospitals. We looked at age, gender and ethnicity. And then we looked at formulations listed in this list, and we asked patients about where they their behaviours or their intentions for disposing of medication if they'd received a medication from these particular places, so a hospital, a GP, a community pharmacy, or somewhere else, so like a supermarket where you might buy simple medication. And these were the return options that patients were given. So for any of those medications or for medications from a particular source, we will ask them if they would return to a pharmacy, dispose of in their household bin. There was an option to recycle. There was an option to pour down the toilet or into the sink. We gave people the chance to say that they would donate it, or there was a chance to say that they would have some alternative process, or simply to just clarify they weren't really sure. And they were the assessment criteria. But as we went along, we also gave patients the chance to provide commentary and anecdotal support for their actions. And they provided some really, inspiring or, insightful thoughts that we can take a look, we can read along with the results. So remember, the gold standard is returning medicines to a community pharmacy for disposal, which is something that is available to all of us in England. And this is the breakdown. So in our pilot study, we had undertaken in Dorset, we had a predominance of older Caucasian patients because that's just a representation in Dorset. And we hoped to get a slight variation in the national piece of work. We did it a little bit, but there was still a theme that the majority of patients were older. So the largest proportion of patients were over 65 years, and then smaller numbers of patients were represented in younger age groups. And 4/5 of our patients identified as white or Caucasian, with about 1/5 being of other ethnic origins. And these are the results. So really interestingly, we found that injections, inhalers, tablets and capsules predominantly were going back to the community pharmacy, which is brilliant. But there's obviously, even in that section, there's obviously room for improvement. The one point that we did think stood out was for injections, where we found that 10% of patients were documented as using some alternative disposal pattern. And when we looked at the commentary and the insight given by patients, a lot of these patients were using council-based collection services because of the sharps components of their medication. So we hope that up to about 70% of patients were appropriately disposing of their injections. But even then, that gives you 20% of patients who were putting their injectable medicines in the bin, and 8% who were unsure. When we looked at what was going in the rubbish, it was almost an inverse. So you can see that patches, drops and topicals tended to go into the rubbish more than anywhere else. And when we spoke to patients, I think the theme that came across is they didn't consider these as real medicines. So we're interpreting, this is something for future research, but patients have an idea in their mind of what a real medication is or what it looks like. So that's maybe something to consider when we're talking to our patients and advising them on how to dispose of their medication. Other points that stood out were that 11% of patients opted to recycle their inhalers. And this is really interesting because we know there's no uniform inhaler recycling scheme across the country, but there are lots of nascent pilot projects. So we're hoping that patients had seen these, had access to these, and were appropriately disposing of these rather than trying to recycle them in their home recycling stream. But the idea that the patients are inspired or desire to recycle their medication is something that's quite interesting. And the other thing that really stood out for us is that 26% of patients, so a quarter of the patients surveyed, said that they would pour their liquid medication down a toilet or into the sink. And again, so this is something that was reflected in the huge international study undertaken by the OECD. It was also picked up in our tiny pilot in Dorset. And so it just seems to reflect the fact that patients look at a medication, they look at their formulation, and maybe they don't think about what it contains. They think rather what it looks, they think about rather the formulation that it's in. And then the last thing we took away from this is that in nearly every formulation that we looked at, there was up to about 10% of patients who were just unsure about what to do with their medication. So there's obviously a piece of work there. There's a patient knowledge that we as healthcare professionals are not supplying. So the takeaway points for the formulation work was that injections, tablets, capsules, liquids and inhalers for the most part are most likely to be appropriately disposed of. Patches, topicals and drop formulations, on the other hand, are most likely to go in the bin, which is something we need to work on. Liquids will most often be flushed, and inhalers are most likely to be recycled. So there's, regardless of what you look at, there's substantial progress to make for all of these formulations in the way that we talk to patients. And then when we looked at how patients dispose of medications according to where they've sourced them from, there was a hierarchy of importance, shall we say, in that the more acute the source of the medication, so the closer you got to the hospital, the more likely it was that patients would return that medication to a community pharmacy for disposal. And interestingly, so if you received a medication from a hospital or a GP, the results were roughly the same. But even then, only 50% of patients would automatically think of a community pharmacy as a way to return their medication. But then there was a real drop-off once patients received medications from their community pharmacy, and then further still from any other source. And this is really important as we move into the new stage of the NHS, where we're trying to develop a left shift of care. We're trying to get more medication out of the hospitals into the community, maybe dispensed and issued through their community pharmacy. There are going to be more potent medications, more pharmacological classes being dispensed out in a community pharmacy. And so it's really important, I think, that we as healthcare professionals and our patients understand that, regardless of where you get your medication from, proper disposal is key. And this is not something that we picked up in the study, but it's my reflection afterwards, in that there was a team of about, 30 healthcare professionals involved in this piece of work. And at the start, I think very few of us actually had a really clear understanding of how medication should be disposed of. And even when we spoke to some of our patients, they said, you know, their reflections were that they received different information from healthcare professionals over time and in different locations. And so I think maybe the first thing we need to do is clarify the education to our to our staff, to our colleagues, so that we can work with our patients. And so just for information, it's been part of the community pharmacy essential services contract since 2004 that patients can return their own medication for disposal to a community pharmacy. And this is regardless of if it's their medication or a relative's medication. It doesn't matter if the medication was sourced from that particular pharmacy. All pharmacies are contractually established for taking this medication as return. And medication that can be returned to the pharmacy is not limited by formulation. So anything that we've looked at today can be returned, but community pharmacies cannot take, unless they have a special additional license, any ancillary product or that is a shop. So they can't take needles or dialysis kits, etc. And then we've got to look at what we can do for patient education. There was a real variation in response across all of the different hospital sites. So I don't know if anybody here is from Cornwall, but I'm going to give you a shout out because the Cornish results were, they were leaders of the pack across all questions asked. And it'd be really interesting, I think, to delve into what the Cornish hospitals do in terms of educating their staff and then educating their patients. But these are some of the resources that we collected from around the country. The bright poster is from a GP who's very heavily involved in making sure that her service is environmentally sustainable, and she's self-designed these and has these up over her surgery. The label in the middle is from a London hospital, so it shows that you can get information onto the tiniest surface. And the other two images, the tree and the toilet, are for a campaign that we ran in Dorset after these results were in. Because we realised that we had a lot of work to do in Dorset. So the tree is now on the bottom of all hospital discharges, so patients see this. And we also ran a Dorset-wide campaign involving social media, encouraging patients to dispose of their medicines properly. And I've put the toilet here just because it was the most popular image in the campaign. We had an incredible amount of likes, interactions and shares just from the pink toilet. So we're going to work with that in future. And then just to finish off with, I'm going to say, if we're talking about educating staff to educate patients, we have to give a shout out to it was the Royal Pharmaceutical Society, now it's the Royal College of Pharmacy Greener Pharmacy Guide, where hospital and community pharmacists can earn bronze, silver or gold level accreditation in sustainable practice. And one of the baseline elements for bronze level accreditation is to advise patients about environmentally sustainable disposal. So we're encouraging all teams to sign up to this. And I will finish off with just some of these quotes that patients provided us with while we were doing the search. So you can see there's an awful lot of variation. There's an awful lot of education to be done within our teams, and these were quotes taken from patients around the country. So there's an awful lot going on, and there's much to be done. But I'll finish there and say thank you very much, and I will hand over to Maddie.
Thank you very much, Tracy, and we'll just wait for Dr. Madeleine Smith to share her slides. So for those of you who have joined us after Tracy's start, apologies to those of you who were struggling to get in. I'm not quite sure why we weren't able to see you in the waiting room. We're going to have plenty of time for questions at the end. Next up, we're going to have Dr. Madeleine Smith, who's a GP and Clinical Director at South Somerset West. Thanks, Maddie.
Thank you, Nuala, and that was really fascinating, Tracy. Thank you. I think my presentation probably kind of picks up where yours has left off, so hopefully this is a nice segue. Can everyone see the slides? Can somebody nod for me?
Yes, we can see them.
Thank you. That's the hardest bit of the evening, isn't it? Well, thank you for having me. So my name is Madeleine. I did a master's degree a couple of years ago in environment and human health at the University of Exeter, and this was part of my dissertation project. It came out of a kind of irritation about the fact that there's so much pharmaceutical pollution, exactly the same tidal wave that Tracy's just described. So I started to look at this and then couldn't really let the subject go. So I've been talking about it ever since. So again, just to recap a little bit, why does it matter? So about £110 million worth of unwanted medicine is returned to the community pharmacies every year in the UK. And an estimated another 50 million of that is coming from care homes. So a lot of work has already been done to reduce this waste. Medication reviews, deprescribing initiatives, polypharmacy monitoring, probably things that you guys are all doing in practice, and low carbon prescribing too. And they're all helping. Repeat dispensing schemes can help reduce over-ordering. We know that sustainable, we are pushing the sustainability message. But there's an unintended consequence to some of these interventions. So some patients are then, medications are stopped, doses are changed, and then patients are left with unused medication, which under current regulations has to be destroyed rather than reused. Despite efforts to reduce the waste, all the things we've talked about, studies suggest that around a third of pharmaceutical waste is still unavoidable. So the environmental impact, which again Tracy's touched upon, it extends far beyond the waste disposal. The pharmaceutical industry itself is very carbon intensive, and the manufacturing process contaminates soil, air, waterways. And unused medications that are improperly disposed of, as we've just been hearing, persist in the environment for a really long time and affect the ecosystems and human health as well. The research has shown that significant effects, even at very low concentrations of some of these drugs. We know about antibiotics, but hormones from the oral contraceptive pill have been shown to feminize fish populations and affect their reproduction. And antidepressants in waterways have been shown to alter fish behaviour, making them less risk averse. So when they see a predator, they tend to fight rather than hide, and therefore get eaten. So that'll be the one fact that everyone remembers from today. So how do we tackle this? One proposed solution has been medicines reuse. By that, I mean retrieving unused medication, prescription medication from the original recipient, checking it and redistributing it to another patient. This is already happening in some countries. In Greece, there's a program called GiveMed. And in the United States, there's a program called Siren, which started in California about 30 years ago. These are mainly for altruistic reasons. They're there because patients can't afford the drugs otherwise. So not an environmental program, but the outcome is the same. In the UK, however, it's obviously medicines reuse is currently prohibited by legislation. So why look at it now? Well, at first glance, medicines reuse does sound quite straightforward, but in reality, it does raise a number of important challenges, particularly around trust and attitudes from both the public and healthcare professionals. So there have been previous studies that identified that attitudes as one of the biggest barriers to reuse, although most of that research was carried out before 2018. Since then, quite a lot has changed. The COVID-19 pandemic exposed the massive fragility of our medicine supply chains. You may be aware that in 2020, the government introduced emergency legislation allowing care homes and hospices in England and Wales to reuse urgently needed medications under specific circumstances during shortages. Although that guidance was withdrawn in 2022, to me, this is what got me thinking about this, that in a crisis, the perceived benefit of reuse could outweigh the risks. So it's not too much of a leap to think about that being extended to an environmental crisis rather than a pandemic. Since then, we've also had several high-profile medicine shortages. The penicillin V shortage for Group A strep outbreak a couple of years ago, and then shortages of HRT as well that have been well publicised in the media. At the same time, public awareness of climate change and waste reduction methods has really increased, and recycling and reuse have become much more mainstream concepts at home. So I kind of wondered whether public attitudes towards reuse might also have shifted. There were also some signs from a professional point of view too. In 2020, the chair of the British Medical Association's GP committee called for regulations to be relaxed to allow reuse of return medication. And in 2021, the RPS called for more research into the reuse of patient return medication too. So maybe the tide was starting to turn. So my little study, the aim of this was to explore the current attitudes within the general public towards medicines reuse, concerns they might have, what safeguards that they would consider necessary. it was also the first study to explore the views of community pharmacists and pharmacy techs on the issue and the barriers that they might anticipate as well. So the study used 2 self-administered questionnaires. The participants were recruited through social media mostly, and for the public survey, we also put posters up with QR codes in community pharmacies, in the village halls and lunch clubs and things, basically where the community congregates. So this was down in Somerset, in my area. It was intended to capture people who were most likely to be using regular medication. But obviously that is a limitation of the study. It's online recruitment, so it excluded people without internet or smartphone access. But my budget didn't stretch to paper surveys at this stage, I'm afraid. So we had 192 responses from the public, which was a pretty good sample, and 27 community pharmacists and technicians. So start with the public. Of the public respondents, so as with lots of surveys, 75% of the respondents were female. Nearly half were aged 55 or over, and 64% of them taking daily prescription medication. Echoing what Tracy found, 38% admitted disposing of medications in household waste, and 8% said they put them down the drain. 15% of patients on this survey believed that medicines reuse was already happening in some form, which I thought was really interesting. And although the numbers were quite small, again, something I thought was really interesting was that the patients who were over 55 were actually more willing to accept reused medication than younger respondents. And that was independent of how frequently they used the medications. So I thought that was, again, quite an interesting generational split there. Concerns. So safety was by far the biggest concern for the public. 57% agreed or strongly agreed that they had concerns about safety, and 42% had concerns about effectiveness. But there was a very high degree of trust in community pharmacists. 94% said that they would feel reassured if the medicines had undergone professional visual inspection. So literally just looking at the tablets and the packaging. The free text response, we took some qualitative data too. Common themes from that included concerns about stockpiling and over-ordering, and there were concerns raised about malicious tampering. And a couple of respondents mentioned practical inconvenience like queues or extra paperwork at the pharmacies, suggesting that convenience is quite important for public participation. So this is onto the pharmacists. So we had 27 pharmacists and pharmacy technicians, aged between 25 and 64, I think. And they had experience ranging from between 1 year and 36 years, so quite a widespread. Their primary concern was, again, safety, particularly contamination and storage conditions for them. 92% were also concerned about contamination. There was strong support for the use of technology. That was a question we asked with if there was technology available to provide that reassurance, so sensors on packaging and things, that would be something that they would really support. And the qualitative responses, again, highlighted several recurring themes. Staffing pressures, of course, storage requirements, legal liability, and financial reimbursement. There was one respondent who raised concerns about deliberate tampering again, and another raised the possibility of resistance from the pharmaceutical industry. So this graph just illustrates the views on this, which we've just spoken about. So again, primary concern being safety, and again, I think it's interesting that the pharmacists were significantly more concerned about safety than patients, and that the patients were very easily reassured by visual inspection, but actually the pharmacists wanted more in the way of technology, unsurprisingly. Both saw the benefits for costs and for the environment. And interestingly, the pharmacists, I think, were probably slightly more supportive of the environmental side than the cost side. So overall, the results show very strong public support for medicines reuse. And this has gone up since the study was done in 2018. So as we thought, but at the same time, both groups highlighted the ongoing concerns about safety and logistics. As I said, the public seemed to place considerable trust in the pharmacists, whereas the pharmacists wanted the technological safeguards. So we asked a follow-up question to the pharmacy group. We asked them about possible ways to overcome the barriers to implementation. And this was a really good question because several themes came up repeatedly. So there was a lot about patient education, which again, I think Tracy's touched upon, which is clearly crucial to the success of any of these projects. The legislative change, obviously, as well, because that would need to underpin everything we do going forward. And financial incentives. So that would need to be built into contracts too. And again, the use of technology. One really interesting idea that came up from this was the concept of centralising collection and redistribution rather than that being on the individual pharmacies to manage reuse themselves. That's quite interesting because the pilots that have been run on this in other parts of the world, in Denmark and Amsterdam, they looked at this and they did it as single pilots based at practice levels with pharmacies collecting their own medication and storing it. But the model of having centralised distribution is very similar to what they do in Greece at the moment with the GiveMed scheme, where patients send it off in the post and it goes to a central sorting office, I suppose. Obviously, this would reduce the pressure on community pharmacies and overcome the storage issues, but I think it will also help in terms of the efficiency and consistency in the checking procedures, because this would be people who are doing it all the time rather than just infrequently. With regard to the technology side of it, sensors, there's a team at King's College who are currently looking at doing some research into looking at using very low cost temperature and humidity sensors which can be attached to packaging. So they're currently in use in the food industry and other parts of the world. So these would be simple, low cost and easy to attach, and they give a record of the way that medication's been stored, so which should improve kind of stakeholder confidence, I suppose. So to wrap it up, medicines reuse seems to have strong public support, particularly perhaps now because medicines waste is such a visible and relatable issue. But implementing a scheme in the UK would be really complex. It would require change in legislation, regulatory approval, patient education, all the things we've talked about, and engagement with both the pharmaceutical industry and probably pharmaceutical organisations too. I think if we were going to go forward with looking at this in more detail, the next stage would be to look at this idea of centralised medicine banks. I think this deserves some further exploration, and it removes the responsibility from individual pharmacies, so they can be verified centrally and then re-enter the supply chain. I think that combined with barcode systems and the temperature and humidity sensors, that would help to address the concerns about storage and degradation of drugs. So we could do this via the digital platform as they use in Greece, which I think would be helpful. Patients can upload their information using their smartphone and then send it off in the post. But I think what was particularly encouraging was that the pharmacy professionals didn't seem to be fundamentally opposed to medicines reuse itself. It was mostly practical rather than ideological. And if the logistical barriers could be overcome, it could give us that triple bottom line, reducing the waste and the environmental harm, reducing the financial losses, and improving access to medications. And I think that's probably the note that I'd end on, because even within the NHS, where prescriptions are mostly free to the patients, we make difficult financial decisions at policy level all the time in terms of the drugs that the NHS will fund and the ones that they won't. So if we're in a position to reduce the waste, it may be that money can then be used to fund treatments that are currently considered too expensive to provide. So thank you very much for listening. I will hand you back over to Nuala.
Great. Thank you very much, Maddie, and thanks also to Tracy. So we have now for questions, everybody, so do feel free to switch your cameras back on if you wish. You can either raise your hand to ask a question or pop a question in the chat box for either of our speakers. So there was a question earlier on, Tracy, during your presentation, Sarah Frank asking if your data is published anywhere, if you're planning on publishing your data anywhere.
It's not at the moment. I'm looking into it. So yeah, I promise if I do, then I'll share through the CSH.
Thank you. I think you have put a summary on the Pharmacy Network, haven't you, on the CSH network?
Yes, yeah.
Just while we're waiting for other questions, Maddie, I just wondered if it's kind of, because it's a few years since you've done this work, do you think is there any sort of movement sort of more centrally or from government to look into this? And I'm thinking sort of specifically with the kind of the current situation with what's going on in the Middle East and that sort of impacting transport, and there's concerns about shortages of all sorts of things, including pharmaceuticals. Have you seen sort of any shift in the time since you've done the study?
Yeah, so that was 2024 when I did this study, and that's so kind of a few years out from the pandemic. And I think every time we have one of these crunch points, people make noises about changing medicines reuse policies and things like that. So every time something happens, we all go, oh, we should do something about that, and then the impetus seems to fade away again. So I say there've been some really interesting noises from the RPS and from the BMA. So I think people are starting to talk about it, but I'm not aware that there's been a sustained kind of encouragement this time.
Yeah. I think because the fact that it's happening in other countries, that there's precedent there, I suppose, isn't there? Okay, we've got a couple of hands up. If you want to just introduce yourself before you ask the question, I'll go to Janine first.
Hello, my name is Jamie. I'm the renal pharmacist in Northampton General Hospital. So thank you, Tracy and Madeleine, for your presentation. So I do have a very big passions on medication waste, but mine is a hospital setting. So I just want to see whether you have any insights, because from my point of view is we, in terms of in hospital, again, pharmacy storage is so limited. So even people know there's such a huge medication waste, they can't really do anything about it because of the system. They can't even reuse some of the parts packs of medication. So by example is if we supply a box of like a Ramipril, if we only use one dose and then the doctors change the medications or the doses reduced, the whole 27 tablets is go wasted. And because just because there's no storage in the pharmacy storage. So like from my thinking is in hospital, the pharmacy is actually causing the waste rather than in terms of like medication optimization, etc. And I don't know about like how other hospitals practice are, but this is really serious that I don't know whether we have thought about any plans or any insights about this.
I don't know what's happening nationally, but in the trust that I last worked for, we went for a really low tech but very effective solution. Is we employed somebody for half a morning every couple of days who literally went around all of the wards, collected all of the stuff and returned it to stock, so that it stopped the environmental impact, like reduced the medicine spend, and it was phenomenally successful. But I suppose as hospitals get more high tech, there's probably a more advanced ways than they'd like to locate the medication and return it to stock on the wards using barcoding and individual item tracking. But I think Claire has said Leeds have lockdown on this, so maybe Claire's got some comments.
I guess also like it depends whether your pharmacy robot can take into part pack as well, because at the moment our robot doesn't. So even we have the staff resources to bring it all to pharmacy, we have no idea how to store it. So at the end, it will still get disposed.
That's really frustrating, isn't it?
Yeah. I do have a slide at the end, but our next presentation in September is going to be from Fiona Watson, who's working at the Sheffield Teaching Hospitals Trust, and that's about them reducing medicines waste at the point of discharge. So slightly different, but along the same lines. I'm going to go to Claire, if that's okay, because Claire had mentioned about Leeds have done a lot of work on this. So do you want to come in, Claire?
Yeah, sorry, my camera's not working at the moment, but yeah, I heard, I'm trying to remember what the guy's name is desperately. I haven't got it on me, but they've definitely done quite a lot of work at the Leeds Teaching Hospitals, and it was the person in charge of procurement, who's a pharmacist. I think it's Philip something, sorry to be so vague. And they've really successfully done it. So they must have more space than you've got. So that's all I know. Sorry,
great.
not very helpful.
No, that's great. Thank you, Claire. I think we can look into that.
Yeah, I'll find out and tell you. Yeah.
Great, thank you, thank you. Yeah, because we're really keen to get all of these examples up on our network. There are some examples already on the network around medicines for use in hospitals, and we had a presentation last year around reusing some of the aseptically produced products, so you can see that on our YouTube channel. Next I'll go to Sarah Frank, who's got her hand up.
You. Sorry, I'm like a one-trick pony. It's the same question to Madeleine that I'd asked to Tracy. Is yours published either? Just I'd love to quote both of your research in the thing that I'm writing. So
no, it's not, and it's something it's on my to-do list is to do that, but I haven't actually got around to it. So thank you for reminding me and pushing me. So when I get that sorted, I will let you know, and you can quote it. So
perfect, thank you. And the other thing was about the carbon footprint of the sensors. Is that something that the team, I've lost where it was now, I don't even know, Kingston, is it?
It was King's College. So
King's College, sorry.
Yeah.
Because when I looked at it, I'd kind of like thought, oh well, that's just not a non-starter, because the carbon footprint of the sensors, for the amount that gets brought back, you'd have to waste so many of them that all get thrown away, and that'd be like you sticking plastic on every box.
So this is the thing. I think they looked at it, that study was looking at how it changed patient behaviour and perceptions rather than about the kind of carbon footprinting of that. And kind of, I think they thought it would probably stack up financially, but I don't think they looked at it from an environmental perspective, because their interest is more to do with patient behaviour. And it was interesting because it did seem to really change the way that they perceived medication and how they stored it and looked after it. So it's an interesting note. But yeah, I don't know from an environmental point of view, I'm afraid.
No, thank you.
Yeah,
I just found all the lead stuff now. I've chucked it in the chat.
Thank you.
So I just remembered where it was.
Brilliant. Thank you so much, Claire. That's great. Another question for you, Madeleine, in the chat box. In the Greek example, is there an ask or hold on any particular drugs to avoid a glut of unwanted drugs?
Yes, there is. It's a really interesting project, GiveMed, but there's very little published in English. So I had to go and have a very interesting conversation with a Greek lady from Athens who was really, it was one of the strangest things I've done. It was brilliant. But she was fascinating. And yes, they do. So if you want to return your medication, you scan the barcode, because I think the EU still uses barcodes on all pharmaceutical packaging. And so they can scan the drug with your smartphone, upload it, and it will tell you whether they can accept it or not. So there were certain drugs that they can and can't accept, and obviously high value drugs particularly they're keen to have returned, because this is being done for altruistic reasons. So what you scan it, you have it accepted, it pings through and says yes, you can send it off, and then you put it in the prepaid envelope and off it goes to be checked and reused.
Excellent. Thank you. And so then another question from Aisling O'Leary. Maddie, you mentioned pharma. How do you think engagement with the industry might look?
Yes, I mean, this is the question, isn't it, all the time? Because when we ask them for data and information about expiry dates and things, they're often not particularly forthcoming. So there's, we try and make moves towards enhancing the life expectancy of our drugs and using them differently, and we do sometimes get some pushback. But I have to say, I spoke during the course of this project, I spoke to two people who are working in the pharmaceutical industry who they do obviously have their green people within that, their sustainability within those organisations. And I think it may have been lip service initially to make their shareholders happy. I think they are now genuinely aware of some of the obligations they have. And I think they would probably see these kind of schemes as maybe, because they're smaller, they're not going to dent things as much as them being asked to redesign medications to make them less biologically polluting or, fewer active metabolites. So I think that they would probably tacitly support some of this if we made a change in legislation, but that's got to come from the professional bodies initially, I think.
Okay, great, thank you. And Amina, you've got your hand up. Do you want to go ahead?
Yes, please. Hi, Noella. Apologies, my camera's off because my connection is really bad. Thank you very much, Tracy and Madeleine. Really inspiring presentations. I think it's really useful to see these examples of work. I work in Scotland up in NHS 5, and within the Pharmacy Directorate, we've got a medicines management nurse alongside a pharmacy support worker who are working at the moment at reducing waste from care homes. They're focusing mainly on non-medicines at the moment, so things like dressings and items like that, and the work that they are doing is saving a lot of money. So basically they are scrutinizing, you know, they go to the care homes, remove any excess stock, take it to a storage unit within one of the hospitals, and when it's ordered again, it's then recycled in a way, so that it's not just sitting in a care home where it's not being used. And they do a lot of other work as well. So I think I'll probably get in touch, Noel. I think it'd be useful if they share their work as well. We're one of the few pharmacy directorates that have nurses as part of our team as well, kind of working within the pharmacy team, and that's a great role as well for a pharmacy support worker. She's been doing a fantastic piece of work at it. So it's really good to see all these examples, and it was really good to listen to the presentations today. Thank you.
Yeah, great. Yeah, thank you. Please do forward any work. So if you can connect with me on the CSH Pharmacy Network and just message me via that. And if you've got a case study or a summary, we can definitely post it on the network. That'd be fantastic. Thank you, Amina. Okay, do we have any? Sorry, go ahead, Tracy.
Just a comment I had relating to Maddie's work. So we have one particular really passionate lady that writes into us quite often in the ICB, but one of her absolute drives is that she's frustrated that she looks after her medication perfectly at home. She keeps an eye on the temperature, she keeps it in the fridge if needed, and she's really helped us with deriving like patient campaigns, because she's frustrated, like really cross when she takes it back to a pharmacy and it can't be reused, and she was like, this is perfect and you're just going to burn it, you know. So I think there's a real drive for a certain group of patients to really make this happen, isn't there?
There really is, and some of the qualitative stuff that came out from the studies was fascinating from the patients. The examples I'm thinking of are a patient who had done the classic thing of leaving the building, stand outside, check the medication, realised it wasn't right, and then took it back in, and then saw it go in the bin and was just absolutely up in arms about the whole thing. And the other example was a patient who in a care home whose injection, I don't know what it was, but had been stored at the GP surgery in order for safekeeping. So it'd been dispensed, brought to us, stored at the surgery, and then the patient had died and the medication had to be again disposed of, despite the fact it hadn't even, so that supply chain had been maintained the whole time. And I think it's those kind of stories where people go, this is crazy. Obviously, we've been into patients' houses. Sometimes you could think, oh, actually, I don't want to take something that's been in somebody's house. But when you can verify where it's been and how it's been looked after, particularly with care homes, I think there's low-hanging fruit there. Some of this.
Yeah.
And it's very visible to patients. So.
Yeah, absolutely.
Yeah, particularly when you have national stories about potential medicines shortages due to like international transport issues, isn't it? Yeah.
I think that's really changed perceptions.
Yeah, absolutely. So definitely, I think something we need to be taking up with our professional body to try and sort of get some momentum behind moving this forward. Okay, do we have any other questions? I don't see any more hands up. Oh, one more hand up.
Sorry,
Janine?
it's me again. Just quick questions. Is we're going to reduce medication waste, may not be reusing, but it's more about reduce the duplication supply. So I've been doing another project is to encourage people when they come to the hospital, try to order their own repeat prescription, their regular medications from the community, rather than asking hospital to get another new supply. So when they go home, they'll be faster discharged and only need the new medication and change medications. Do you see in terms of if there's any like implications from the community, like primary care point of view, whether this will cause more problem, or do you think this is actually encouraging and patient will accept this, and GP is also has no issue with this? Obviously, I know it's like individual context circumstances, whether if they're going to a new placement, then we'll supply everything, including their regular medications. But it's just trying to reduce all this duplication if they have already got it at home, or they can order through an NHS apps.
And is this ordering for when they go home rather than in the hospital? Yes.
Yeah, just in
Yeah.
anticipation for them to go home. So then we can just ask them, can they order some just in case, like, yeah, if you are going to go home, you don't have to like asking hospital to get you another supply, which again, when we supply, it will be a different manufacturers, different dosage, which again, it can confuse people.
That's something we see with patients who are in hospital. Daughters ordered their regular meds ready for when they come home, and actually it's all been changed while they've been inpatient, so it all gets wasted then. So
yeah, it's another case of joining the dots, isn't it? And the communication, and I think also patients sort of managing that system as well, because often those patients will have, if their medication hasn't changed in hospital, they have a supply at home. You know, they don't need any more. They don't need to be waiting around for their discharge prescription in order to get out of hospital, which is often one of the things that delays people's discharges. And I think that's actually the main topic of our next presentation in September from Fiona in Sheffield. I think their work is around talking to patients at the discharge planning stage and asking, well, what meds do you have at home? Because if you've got 28 days at home, we don't need to give you any more, you know, off you go sort of thing. So yeah, there's so many different threads to think about, isn't there? And so many, I guess, opportunities where we can hopefully minimize the waste.
And so often it seems to be it's the communication, isn't it? If you get that right, they could all line up.
Yeah, absolutely.
And
If
I think
everybody could talk to each other.
From my point of view is so I know Fiona is doing targeted the discharge point of view. I'm also focusing on like drug history point of view. So if we document very clearly, if patients got enough at home for like say 2 to 4 weeks, then it actually give the pharmacist like a confidence to say when people going home on the TTO, we're not going to supply all the regular medications. So I do have a poster tomorrow to Clinical Pharmacy Congress, which we will talk about this. Yeah.
Excellent. Okay, I'm going to go to Joe. I think that's going to be the last question because we'll need to wrap up. Go ahead, Joe.
Yeah, it was actually to address the point that Jenna brought up. The Patients Own Drugs campaign is something that Greater Manchester has been running for the last 18 months to try and improve the use of patients' own medicines while they're in hospital, and acknowledging that they may have those medicines at home already or supplied by a community pharmacy, and we'll have those through recorded through Medicine of Reconciliation, but it's actually being taken up further by the ICB in Greater Manchester as part of their Medicines Waste campaign as well. Thank you.
Fantastic. So that's another example to go to. Thank you, Joe. Okay, thank you very much to our speakers this evening then, Tracy and Madeleine, and we have recorded this session this evening and we'll be posting it on our YouTube channel. Just a few slides to quickly finish up. This is just a link to the Pharmacy Sustainability Network. If you haven't already joined the network, please do. The QR code in the corner will take you to the Pharmacy Network. Lots of great examples of projects and case studies on there, and also the opportunity to start conversations, throw out questions, get information from people who are doing similar pieces of work. So please do join if you haven't already. Greener Practice this week launched one of their newsletters and did a piece specifically on medicines waste to coincide with this evening's session. So thank you so much to Greener Practice for doing that. Again, the QR code is in on the screen for you to have a look at that. That's just 10 top tips, and it's pitched at prescribers, patients and pharmacists. So some great resources in there, including the 15-minute education video that CSH did as part of our Medicines Waste and Care Home project. And that's an educational video for staff in care homes, community pharmacies and GP practices around medicines waste, and what the issues are and how to reduce medicines waste. So hopefully a useful resource for staff, because we talked about education there. Just a kind of bit of a shout out for Greener Practice. If you're in the UK and you work in primary care, Greener Practice is just a fantastic resource for everybody working in primary care. Lots of examples of quality improvement projects that are basically off-the-shelf projects that you can just go in and access all of the information and resources that you need to run those projects in primary care. And then just to let you know, for our next event is going to be in September. So we're taking a little bit of a break over the summer months. but our next event will be on the 22nd of September and will be from Sheffield Teaching Hospitals, again around reducing medicines waste. So we will be promoting that on the network. It's not available just yet, but will be available in the next month or so. So if you're on the network, you should see that, and we'll also be posting it on LinkedIn and the usual sort of social media. So that's it from everybody for this evening. Thank you again, Madeleine and Tracy, for your inspiring presentations, and thank you everybody for coming along and engaging and all of your questions.